Welcome to AFD TV. I am Dr. Steve Samudralo with America's Family Doctors, and today we have our special guest, Dr. Aaron Millstone, Associate Professor of Pulmonology from Vanderbilt University and Williamson Medical Center. Dr. Millstone, welcome to AFD TV.
Thanks, Dr. Sam. I'm happy to be here.
Today we have some questions from our viewers. Our first question is from Amber from Brentwood. The question is on allergies and asthma. Aaron, why are asthma and allergies on the rise?
Well, Amber brings up a very important question. One of the reasons that asthma and allergies appear to be on the rise is that we're much better today about making the diagnosis of asthma and allergy than we ever used to be. There's more use of diagnostic tools like pulmonary function testing in the office, so more people are being diagnosed with these problems.
Great. And Aaron, tell me more about our rising concerns over indoor air quality.
Well, indoor air quality is a major problem, and as we get better and better with building houses and businesses, we essentially seal in the air within these structures, and there's no circulation of air. And so what happens is that dust and other allergens tend to build up over time and eventually overwhelm our body's response to fight off an allergic response to these problems.
Great. Do you think allergies are worse this year, Aaron, in Middle Tennessee?
Absolutely. I think what has happened in Middle Tennessee is that we've had a very wet spring, and you can imagine that the more humidity in the air, the wetter the environment, the more likely we are to breed things like mold, and pollens are less apt to move out of the environment.
What can we do to lessen our allergy symptoms?
Well, this is a difficult question because lessening our allergy symptoms really comes in two manners. One is to find out first what you're allergic to and then target medical therapy against that particular item, whether it's pollen or dust or molds. In addition, it's very important to treat other problems that the patient may have that may be exacerbating their allergies. For instance, if they have nasal drainage or if they have reflux disease, that sometimes can make allergies worse.
Great, great. What are the best ways to treat asthma?
Well, asthma treatment comes in a number of different ways. Certainly there are medications, so seeing your family practitioner or your pulmonologist about medical therapy is important, but there's also a lot we can do in the environment to help treat our asthma. Keeping your indoor air quality good, preventing exposure to certain allergies that you know trigger your asthma, and again, even treating acid reflux disease are important in asthmatics.
What are the best screening methods to detect asthma and allergies?
Well, there are two ways to do this. First, on asthma, the best asthma screen is really to do something called pulmonary function testing. And what happens in pulmonary function testing is that you're able to measure a patient's lung capacity. When they have an asthma exacerbation, that lung capacity goes down, and so that's very suggestive of asthma. As far as screening for allergies, that can be done either through blood testing, looking for a response to allergies, or something called skin testing, where your body is exposed to a number of allergens under the skin, and your doctor reads to see whether or not you have a skin reaction to those allergens.
Great. Well, thank you so much, Aaron, for sharing with us on asthma and allergies. As always, if you or your friends and family are concerned about asthma, allergies, feel free to email or call us to make an appointment to discuss this further. For next week on AFD TV, we will be presenting smoking. Why should we now quit? And is Chantix right for me? From all of us at AFD TV, wishing you a happy and healthy week.